Implant technology in the field of dentistry is by far the most profound evolution that we have today. We've been using it now for 25 years and it's only getting better and better. It's the closest thing that we can have to our own natural teeth when we unfortunately lose our teeth. When the implant is integrated in the bone, it is 1.5 times stronger than your own natural teeth. It's a biocompatible material, very similar to the technology we use nowadays in joint replacements like your hip or your knees or your elbows and your shoulder. The body accepts and absorbs the implant to the jawbone, and it feels completely natural. Once the implant is integrated to the bone and the crown is made, you can't even tell that it's not your natural tooth because it feels like a natural tooth. It feels like it looks like it functions like a natural tooth, and it's the most conservative way for us to restore and recreate what the patient has lost. Now, the myth out there is that every single missing tooth should have an implant. That's usually the case, but not always. Every patient is different. Some patients are the best candidate for having implants. This way you don't touch the teeth on either side, you can floss between your teeth, and it's the most conservative way to go. Sometimes in some patients, they are not the best candidate for implants, and the more traditional bridge or a partial might be a better solution. So in my practice, you can have the same missing tooth in 2 different patients. And my recommendation to those patients could be totally different. It depends on their age, it depends on the quality of the bone they have, it depends on their medical history, it depends on systemic factors. Many factors come into play to recommend as to what is the most optimum approach for a patient, whether to have implants or not. I myself, I have an implant. I did it about 15 years ago. It works, and it's usually a lifetime treatment. Once the implant is placed, it stays there the rest of your life. The jawbone is like a magnet. It grabs the implant to the jawbone, and it becomes incredibly strong. And I was telling you earlier, it's 1.5 times stronger than what we were naturally born with. It's incredibly strong, it's incredibly effective, and it's very long lasting.